Funds webinar organized by the Bill and Melinda Gates Foundation in partnership with the African Leaders Malaria Alliance, ALMA. My name is Clélia Frogel and I'm the ALMA Scorecard Hub Manager. Before we begin the webinar, 2 quick items of housekeeping. First, language interpretation is available for French and Portuguese. To access this, please click on the globe icon at the bottom of your screen and select your preferred language. Pour nos participants francophones et lusophones, vous pouvez accéder au service d'interprétation en cliquant sur l'icône en forme de globe en bas à droite de votre écran. Second, please ask questions. You can use the Q&A feature on Zoom or the chat, and we have reserved some time at the end for our esteemed panelists to answer your questions. So ask away. I'm now delighted to introduce Dr. Paulin Basinga for his welcoming remarks. Dr. Paulin is the Director of Health for Africa at the Bill and Melinda Gates Foundation. Prior to this, Dr. Paulin led the foundation country team in Nigeria after spending many years working in public health in Rwanda. Dr. Paulin, thank you so much for joining us. I'll now invite you to deliver your welcoming remarks.
Thank you very much, for having me here. So we are very excited to join our colleague from the Africa Leaders Malaria Alliance today from various councils and funds across Africa. We at the Bill and Melinda Gates Foundation have been working with the African Leader Malaria Alliance since it was launched in 2009. As you all know, ALMA is head of state and government organization, representing the 55 African head of state and government, and is one of our key advocacy partners for promoting malaria control, elimination, and ultimately eradication. Over the years, we've been quite impressed by how ALMA has defined advocacy in malaria and engaged with partners across Africa. At the Gates Foundation, we are guided by the principle that all lives have equal values. And our mission is to help all people lead healthy and productive lives. But this mission will not be realized without ending malaria, particularly in sub-Saharan Africa. As such, we remain committed to reducing the burden of malaria, accelerating progress, and getting ahead of new threats and challenges, such as drug and insecticide resistance that we're seeing increasing in Africa. Today, we will hear how several countries are working to advance these priorities through the End Malaria Councils and Funds. I'll let my fellow presenter better explain what these councils funds are. But in short, the EMCs and EMFs are innovative public-private partnerships focused on removing the barrier that slow progress against malaria. Just as the Gates Foundation seeks to complement existing stakeholders, EMCs and EMFs complement national malaria control program, development partners, and funding mechanisms. By convening senior leaders across all sectors, they break down the silos between government, businesses, and communities. They serve as a forum where operational bottlenecks and resource gap can be escalated so that resources can be mobilized and progress can be made. They help promote initiatives like Zero Malaria Start With Me. This is an amazing campaign that you'll be able to hear about it today, and also encouraging everyone from head of state to head of household to take responsibility and action to end malaria. Today, you will hear about the End Malaria Council and Funds, and you'll hear what they've been able to do. They've enabled life-saving intervention like indoor residual spraying to take place in hard-to-reach regions where resources were not otherwise available, and how national outreach and communication campaigns were scaled up to remind people to seek testing and treatment for malaria despite COVID-19 pandemic. Because in these times where COVID-19 is really one of the pandemic that people are talking about, people may really pass very important cases of malaria, which continue to be the biggest cause of mortality in our region. You'll hear about how End Malaria Councils and Funds encourage countries to proactively share data across sector and use different tools like the National Malaria Scorecard to identify operational gaps and advocate for solutions that expand coverage of life-saving commodities. Also, during this webinar, you'll hear how End Malaria Councils and Funds have recruited diverse chorus of malaria champions. each with unique skills and capabilities, and can help strengthen the fight against malaria. When you hear what they've been doing with the leader in the private sector, those are leader of industries that have staff working from them, for them, that have people who are engaging with communities. As those leaders in the private sector, they understand the work that the National Malaria Program doing across countries, and they've come together to really help the Ministry of Health and be part of the End Malaria movement. This is quite amazing. We also hear about some of the people that we respect in our communities, our traditional leaders. They've come together and they've taken malaria eradication as their top priorities. I'm really excited to hear about these experiences, and I hope that you will be inspired as I was in engaging in this work. Without further ado, I would like to introduce Mrs. Joy Murphy, who is the Executive Secretary of ALMA, to just welcome you and give you a sense of what you're going to experience today. Thank you very much, and the Gates Foundation remain really engaged in this partnership. Joy, up to you now.
Good day, colleagues and partners. The Africa region has made significant progress in the fight against malaria since 2000. Between 2000 and 2019, malaria incidence and mortality rates declined by 40% and 67% respectively. As a result, 1.2 billion malaria cases and over 7 million malaria deaths have been avoided. The return on investment has been massive, with $60 created for every $1 invested in Africa. Nevertheless, malaria remains a leading cause of illness and death, and progress against malaria has stagnated. The sustained burden of malaria imposes a significant cost on social and economic development across all sectors. We know from past studies that malaria reduces economic growth by up to 1.3%. We also estimate that malaria causes up to 500 million days of work to be missed each year in Africa due to worker absenteeism. We also face increasing challenges from insecticide and drug resistance, climate change, from COVID-19, and the significant resource gaps. Therefore, it is critical that we mobilize now to accelerate progress and end malaria. As we know from countries that have successfully eliminated malaria, anti-malaria requires that we sustain malaria high on the national development agenda, that we drive increased action across all sectors and at all levels, down to the community level, and that we mobilize additional resources to fully fund the activities in national malaria strategic plans. The current chair of ALMA, His Excellency President Uhuru Kenyatta, has defined 4 legacy priorities to help achieve these goals.
And so I therefore urge my fellow leaders to champion the following actions in your respective nations. The first of these is to increase coordination and engagement on the elimination of malaria through regional economic communities. The second is to expand access to quality health care through national malaria scorecards to inform and to empower individuals and communities to take individual action. The third is to establish national End Malaria Councils and Funds to convene senior leaders across all sectors to champion malaria and mobilize action, resources, and also to drive accountability. And fourthly, to recruit and mobilize a new generation of youth to combat malaria. Zero malaria starts with me, with you, and with all of us together. I thank you.
Countries across the region are establishing country-owned, country-led End Malaria Councils and Funds to help achieve these objectives. To date, councils and funds have been launched in Zambia, in Eswatini, Mozambique, Uganda, and Kenya. Additionally, councils have been announced with final preparations underway in Cameroon, in Burkina Faso, and in South Africa. Additional End Malaria Councils are in the process of being designed in countries across the region, including Tanzania, Nigeria, and Gabon. I would now like to let Stephen Mtetwa from Eswatini's End Malaria Council and Fund to explain exactly what they are.
End Malaria Councils and Funds are country-owned and country-led structures composed of senior leaders from each sector, inclusive of government, the private sector, and communities, which work in partnership with the Ministry of Health and National Malaria Program. Public sector members could include government ministers, principal secretaries, parliamentarians, sub-national governors or mayors, and leaders of parastatals like national banks or the Revenue Authority. Private sector leaders include senior business executives and leaders of trade organizations like the Chamber of Commerce and Industry. Community leaders could include executive directors of civil society organizations, religious leaders, and traditional leaders.
As Executive Secretary of ALMA, it has been a great joy watching these End Malaria Councils and Funds come to life. There is no one-size-fits-all approach. Each is unique and tailored to the local context. We remain committed to providing technical assistance and support to countries across the region as we aim to achieve our chair's target of establishing 15 End Malaria Councils and Funds. Ladies and gentlemen, today we are joined by several End Malaria Council members and Secretariat staff. We will see a number of short videos and hear directly from them about their experiences, mobilizing, advocacy, action, resources, and accountability. Advocacy and accountability are two of the most important priorities for ending malaria. Advocacy and accountability are necessary to ensure that malaria remains high on the national development agenda and is a priority across all sectors. In particular, it is important to engage trusted community leaders, including traditional leaders, the clergy, parliamentarians, and civil society organizations. To begin with, I would like to turn to our colleagues from Zambia to share their experience working with community leaders in the fight against malaria.
I'm Chief Omena of the Kalumbila District of Northwestern Province of Zambia. I chair the Northwestern Province End Malaria Council. I also sit on the National End Malaria Council of Zambia. Sometime in the year 2019, I received an invitation from the Ministry of Health in order to come through and serve the nation on the End Malaria Council. And I gladly accepted because for me, it was a continuation of something that we were already doing. And I was excited that we could be able to do it at a higher level while we share our experiences, but also learn from what others have been doing. The National End Malaria Council is a multi-sectoral council which is composed of senior leaders from across the country. The whole purpose of the National End Malaria Council is to mobilize advocacy, resources, and action necessary to end the malaria pandemic. I was appointed to serve on the End Malaria Council in order to represent the voice of the traditional leaders and also the communities. Ending malaria is teamwork. Together with other people, like-minded people, we can come together and end malaria.
I would like to introduce Dr. Elizabeth Chizema, who is the Secretariat Coordinator for the Zambia End Malaria Council and Fund, a board member of the RBM Partnership to End Malaria, and a senior advisor within ALMA. Elizabeth, it is fantastic to see the commitment and involvement of Chief Mumena and other community leaders with the Zambia End Malaria Council and Fund. Can you please explain what role community leaders can play for the fight against malaria?
When we were first designing the End Malaria Council, we thought it was important to have trusted community leaders as members. His Royal Highness Chief Umumena is an influential leader in Northwestern Province and has become a malaria champion for many years. Involving him was an obvious choice. Other community leaders include Right Reverend Bishop Njovo of the Anglican Diocese of Lusaka and Sheikh Shaban Piri of the Islamic Supreme Council. Our community leaders have organized a number of activities. They have convened religious leaders across all faiths, including Muslims, Christian, and Baha'i, to sensitize them to the importance of ending malaria and taking action to protect their congregations. We have also trained the faith leaders on how to review and use the National Malaria Scorecard so that they can independently review and identify gaps affecting their communities. For the past 2 years, the faith leaders have also organized community marches to raise the visibility of malaria. We have also established provincial End Malaria Councils, which convene additional leaders at the community level. We are developing networks of community-based malaria champions. These champions can review the malaria scorecard and identify actions that we can take locally. We have also held meetings with members of parliament to sensitize them to the importance of ending malaria. Parliamentarians are critical to combating malaria because they are involved in setting national policies, approving the national budget, and representing the interests of their constituencies. And for members of parliament, this is where we hope you can also join the fight.
I would like to now turn to the Fundo da Malaria in Mozambique to understand how it is supporting advocacy through the Zero Malaria Começa Comigo campaign.
My name is Baltazar Candrinho. I am the Director of National Malaria Control Program in Mozambique. Mozambique has a national malaria strategic plan. We want to establish our limits, and our limit is to reduce the malaria case, reduce the malaria transmission, and also reduce the malaria deaths in Mozambique. In August 2020, Mozambique launched the Malaria Funds. The Malaria Funds is a public-private community initiative to aim to promote, in continuation of the campaign, Zero Malaria Starts With Me. And this strategic plan, we want to make sure that we have the capacity to program management at all levels, to make sure that we want to educate and sensitize the population in order to come to health facility as early as they feel a malaria symptoms or any malaria signs. So this initiative, it's very crucial, it's very important. So our commitment is to implement all malaria activities with high quality in order to get better results.
Ladies and gentlemen, I am joined by Mr. Gabriel Jr., who is the director of Mozambique's Fundo da Malaria, a private sector executive and a member of parliament. Gabriel, thank you very much for being here. Can you briefly explain how the fund in Mozambique is driving advocacy and accountability?
As Dr. Candrinho mentioned, Malaria Fund is a public and private community partnership established to promote objective of Zero Malaria Começa Comigo campaign and help to close gaps in the National Malaria Strategic Plan. Yeah, Malaria Fund is an independent non-profit organization governed by an independent board of directors and chaired by Dr. and Reverend Felicidade. Our other board members include the senior private sector executives from key industry, such as including oil and gas, finance, religious leaders across various faiths. Ahead of World Malaria Day, we conducted a community community outreach campaign involving two civil society organizations, FDC and PECON. During these campaigns, we produced a series of television, radio, and online messages encouraging people to sleep under mosquito nets and to seek testing and treatment if they experienced symptoms of malaria. To have the greatest impact, many of these messages were recorded by local religious leaders. In total, we trained 200 community mobilizers to distribute malaria messaging in priority districts. We worked with 59 religious leaders and reached more than 15 million Mozambicans with malaria messaging. We tried to find every people to talk that it's important all people to be together to fight malaria. If we Mozambicans want and eliminate malaria in 2030. Now we are working to establish a parliamentary forum on malaria. You see, before we didn't have the malaria forum in parliament. We had only HIV group because for parliamentarian HIV was priority. Now the priority is COVID-19, but they understand that we need to be a malaria forum. We need to be the champions to fight against malaria inside of Parliament.
Thank you, Gabriel. I'm now going to bring in Mr. Stephen Mtetwa from the Eswatini End Malaria Fund. Stephen, we have heard about how Zambia and Mozambique are working with various community leaders to drive advocacy and accountability. Recently, the End Malaria Fund in Eswatini hosted an event to promote malaria amongst the youth. Now, this is a critical pillar for ALMA and for our chair and for the African continent. Can you please talk about why youth are so important and why they are a priority for the End Malaria Fund?
In May this year, the End Malaria Fund organized a conference with youth leaders to promote malaria elimination and to liberate on the source mobilization mechanisms to sustain this agenda. The event was attended by Woncha Kachaka, who is also a board member to the End Malaria Fund, as well as the Honorable Minister of Sports, Culture and Youth Affairs, Mr. Harris Matabile.
And you, honorable children of mine, thank you very much for being here.
His Excellency President Uhuru Kenyatta outlined in his agenda as the ALMA chair. Youth are a critical constituency in the fight against malaria. They are the future leaders of Africa. They are the pregnant mothers and parents to children affected by malaria. They are eager and enthusiastic champions for the Africa we want, a malaria-free Africa.
We need you to own it. So you're here today because we're asking you to become part of the voices of Africa that want to make sure that malaria is eliminated.
Thank you. Now we will shift our focus to the other core priorities for End Malaria Councils and Funds: action and resource mobilization. As I mentioned earlier, End Malaria Councils and Funds work to help the National Malaria Control Program to remove operational bottlenecks and resource gaps, preventing the implementation of the National Malaria Strategic Plan. Two important ways that End Malaria Councils and Funds do this is by mobilizing other sectors to take action to help implement the National Strategic Plan and to contribute in kind and financial resources. I would like to ask some of our panelists to share their experiences with action and resource mobilization. Let us start with Zambia. Elizabeth, can you explain a little more about how the Zambia End Malaria Council and Fund mobilizes resources to close the gap in the National Strategic Plan?
In 2019, His Excellency President Edgar Chagwa Lungu convened senior leaders from across all sectors to form the End Malaria Council. This council was charged with driving advocacy, action, resource mobilization, and accountability. However, because the EMC is simply a forum of members, we recognized that we needed to establish a fund that would be able to receive, manage, and distribute financial donations. This led the members of the EMC to establish the End Malaria Fund, which is a non-profit foundation governed by an independent board of directors, and that reports to the EMC. The EMC and EMF have worked to mobilize commitments from each of our members' sectors. For example, in 2019, it was brought to the EMC's attention that there was a funding gap for transportation of insecticide and other malaria commodities to the northwestern province. As a result, there was a risk that the indoor residual spraying campaign would be delayed, which would put populations at risk. To address this gap, First Quantum Minerals Limited, which represents the Chamber of Mines on the End Malaria Council and routinely runs trucks between the province and Lusaka, agreed to transport the insecticide for free. In 2020, the National Malaria Elimination Center planned to expand mass drug administration in target districts. MDA involves widespread treatment of individuals in a community to reduce the prevalence of the parasite and disrupt transmission. MDA has proven effective in other regions in Zambia. The NMCP mobilized funding for the medicines, but faced a $500,000 budget gap for the training and implementation of the campaign for targeted districts. As a result, members of the EMC engaged the pharmaceutical and the mining company, who agreed to provide the required support. As a result, we were able to close the gap, and MDA was able to go ahead. One of the other operational gaps is the availability of transportation, such as for IRS spray teams or for commodities. The Zambia Revenue Authority, which is also a member of the EMC, donated some of the seized cars and trucks to the NMCP and to the EMC.
My name is Atopsis Kalinda, Corporate Communications Manager from the Zambia Revenue Authority. We are proud to be members of the End Malaria Council. Among the commitments that we have made to the Council are that we will continue donating seized items to the End Malaria Council. For instance, we recently donated motor vehicles to the Council. These are motor vehicles that were seized for smuggling so that they can be used for their administrative purpose and delivering of mosquito nets and other equipment to various parts of the country. This is a message to all of you out there. There's a small way in which we can all contribute to the fight against malaria.
ZRA has recognized that malaria hurts the private sector, reducing the national economic output by the equivalent of up to 50,000 workers a year. As a result, they donated television advertising space and helped produce a series of advertisements promoting social and behavioral change communications.
No! Stay back. Huh? I have COVID-19. What? I have fever, body pains, headache, and nausea. I don't want to die.
Ish, clearly this isolation has gone to your head. If you had COVID, you would have had a cough and difficulties breathing. You, my friend, have malaria.
No, it can't be. Isn't malaria on vacation or something? With mosquitoes far, far away on the beach having a blast, leaving COVID-19 as the substitute.
Voila! This is when mosquitoes are busy. Kindly people are staying home. Besides, how would you have gotten COVID-19 if you've been indoors this whole time? Wait, have you been sleeping under a mosquito net?
Ati?
Always sleep under a treated mosquito net. Let's get you to a clinic ASAP. Remember, malaria ends with you.
Malaria ends with me.
The This message is brought to you by the Ministry of Health in partnership with PATH, Eastdale Flowers Cross-Border Malaria Initiative, the Anglican Diocese of Lusaka, and ZRA, proud members of the End Malaria Council.
We have a number of other initiatives underway being led by the End Malaria Fund, including selling merchandise such as branded t-shirts, placement of donation boxes across the country, and a capital campaign with the private sector. We are also working on developing new resource partnerships. For example, we have recently met with the Zambia Football Association to discuss how we can move together to mobilize resources.
Elizabeth, it seems the End Malaria Council has had a lot of success mobilizing both financial and in-kind resources. Can you explain how you approach in-kind versus financial resources?
Globally, 70% of corporate social responsibility is spent on in-kind support. This has been largely consistent with our experience in Zambia, maybe even more so in the light of the COVID pandemic and economic difficulties. Companies are eager to contribute unique assets and capabilities because they can do it very cheaply, especially compared to the cost of having to procure the goods or services. Thus, we must be creative in thinking about how each sector can contribute. As you see from many of the examples that I've shared today, the greatest value is often derived from sectors contributing their unique skills, experience, and assets to the fight against malaria. Resource mobilization can be fundraising, but at its best, resource mobilization involves developing partnerships that expand the capabilities, reduce costs, and increase the reach of the national malaria program.
Thank you. Now, Gabriel, on World Malaria Day this year, the Fundo de Malaria hosted its first donor conference to mobilize resources to support the National Malaria Control Program. Can you explain how all this came together?
I want to say you that following our launch in September 2020, Fund of Malaria launched a capital campaign to mobilize financial resources from the private sector. Because the COVID-19 pandemic, we had to organize small and virtual meetings with the executive from the companies. During the first quarter of last year, the fund and the PNCM meet with a senior executive from more than 35 large and multinational companies. They included companies from energy, oil and gas, manufacturing, banking, finance, tourism, retail, telecommunication, and transportation. The purpose of this meeting was to sensitize the executive to the impact of malaria and on social and economic development. Malaria was particular concern to several firms operating in north and central of Mozambique, Beira, and where the burden of malaria is very high. As well, those involved in tourism and manufacturing, we tried to tell them to calculate how many workers or families of workers they lost last year because malaria, and how many people sometimes don't come to work because they are sick about malaria. On World Malaria Day in April, the Fund and the Ministry of Health hosted the first National Donors Conference for malaria. This was a very good conference. This conference was attended by senior political leaders, including the Prime Minister, the Minister of Health, the subnational leaders, private sector executive, and development partnership was there, like WHO. And this conference, that our donors, they announced more than 2.8 million USD. I remember in that when was announced this donation, the Prime Minister was surprised because this kind of local fundraising never happened, and was very, very important to show that if we advocate, if we talk, if we tell the people that the fight against malaria starts with you support, with your help, things can happen.
Thank you. One of the benefits of End Malaria Councils and Funds is that they can provide backstopping support to the National Malaria Control Program, especially during emergency situations. I would like now to go to Eswatini to learn a little bit more.
My name is Thandile Ngumalo. I'm the Group Chief Executive Officer of Sanlam Eswatini, and I'm also chairperson of Eswatini End Malaria Fund. Our job as a fund is to say to the program, what are the gaps? And so it was with great pride today that we find ourselves going to the central medical stores to hand over Primaquine, one of the drugs that is important for the prevention of malaria that we have as the End Malaria Fund paid for. We had a tour of the central stores so we can see this drug that's now arrived in Swaziland and that's being distributed to make sure that the Swazis can deal with the scourge of malaria, and giving us the comfort as the End Malaria Fund that the money and the work that we are gathering to make sure that malaria is prevented in Swaziland is actually being used in a beautiful manner that is going to reap huge benefits towards Swaziland achieving our goal of zero malaria. Being able to, as the private sector, corporate citizens, contribute to our nation getting to their goal, which is a national goal that includes us as both corporates and individuals, because we've raised money privately to make it happen, is a huge pride for us.
Nyatsi supports selected socio-economic projects that promote community development and upliftment. It's my pleasure to be joining the End Malaria Fund. I would like to encourage other businessmen and companies to contribute to ending malaria and achieving that target of 2023. In the words of Dr. Delos Cosgrove, the state of our nation is only as good as the state of our health. Together we can end malaria in Eswatini.
This was a great example. Stephen, can you explain more about how the fund has supported the National Malaria Program?
Thank you, Joy. As the board chairperson has explained, one of the key objectives of the End Malaria Fund is to provide a backstopping financing mechanism to the National Malaria Program. As you saw in the clip, Eswatini experienced a stockout of the primary antimalarials that we used to treat and prevent malaria. Unfortunately, the government didn't have the resources to procure the extra additional stock. It is also important to understand this. Unlike larger countries, it can be very difficult for a country like Eswatini to procure relatively small amounts of antimalarials that it needs.
So because of the quantities that we usually try to get from manufacturers, our quantity is small. So they told us we have to wait for another country to bulk the order.
Ask the End Malaria Fund to provide the necessary support.
The National Malaria Program submits requests to the End Malaria Fund, which are evaluated for impact, and if the proposal meets the criteria, it is funded, as we can see. In this regard, a request for procurement of 500 units of the Primaquine was submitted by the program.
Given the urgency, the End Malaria Fund quickly put out a request for proposals and issued out a tender to procure these antimalarials. These were then handed over to central medical stores and distributed to health facilities nationwide. Leading up to the inter-residual spraying campaign in the past malaria season, the National Malaria Program submitted a request to the fund for the servicing of its trucks for vector control. The board found it pivotal to ensure that these vehicles are repaired and serviced for the safety of discovered mid-season that there were a significant number of additional households that needed to be sprayed. As a result, there were a shortage of insecticide and additional resources that were needed to extend the campaign. The End Malaria Fund worked with the National Malaria Program and the Global Fund in its principal recipient nurture to develop a funding plan that would enable us to sustain this campaign. At the onset of the ongoing COVID-19 pandemic, we noted that messaging on malaria preventative and curative measures were being overshadowed by the current crisis Eswatini and the world is facing. The End Malaria Fund offered the National Malaria Program the engagement of a communication expert who would help develop between COVID-19 and malaria messages to keep the public informed on the threat of malaria, especially at this time. This was a complementary intervention as through the Global Fund grant, the National Malaria Program was able to develop its assets in the form of mass media adverts that would be distributed throughout the country. Finally, in 2019, we were approached by the Ministry of Health because the National Disease Notification System had been shut down due to lack of resources. Obviously, this is a critical tool for the ministry, especially the National Malaria Program that relies on notifications from the system to respond to cases within a 48-hour period of reporting. The board of the End Malaria Fund engaged the CEO of MTN, a mobile communications company, to explain the importance of restoring this system. As a result of this engagement, MTN agreed to restore the accounts associated with the disease notification system and provide in-kind support for a period of 2 years through its foundation.
Thank you. Now, before we open up for questions, I would like to quickly ask our panelists how development partners can support End Malaria Councils and Funds. Starting with you, Elizabeth.
We have been very grateful for our partner support, whether it has been the financial and technical support from ALMA or our in-country support from partners like the US President's Malaria Initiative, Global Fund, Path Masepa, Rotary Club, and the UN family. In Zambia, we have established a task team composed of representatives from the National Malaria Elimination Center, the Secretariat to the End Malaria Council and Fund, and our development partners. This task team meets each week to review the status of malaria and discuss the various challenges that the NMCP and its partners are facing. Then we collaborate and work to develop solutions that can be implemented by the partners and the members of the EMC.
Thank you, Elizabeth. Now, Stephen, how about you?
There's a lot of partner support and attention for multi-sectoral advocacy, action, and resource mobilization to combat malaria. The obvious example for this is the Malaria Starts With Me campaign. I think End Malaria Councils and End Malaria Funds can be an incredibly effective mechanism to channel partner resources and technical assistance to Zero Malaria Starts With Me. Our members are senior, influential leaders from various sectors. So by investing through structures like Eswatini's End Malaria Fund, we can strengthen multi-sectoral collaboration and coordination. Zero Malaria Starts With Me.
Thank you so much, esteemed panelists. We will now answer some questions from the audience, as well as the questions that were submitted in advance. So our first question is directed at Joy. We have heard how EMCs help countries mobilize advocacy, resource, and action to help accelerate progress against malaria. Why do you think End Malaria Council will be able to mobilize funds given the pressures that the COVID pandemic has placed on our economies?
Thank you so much, Clelia. You know, as we have heard from all the End Malaria Council members and supporting secretariat, the End Malaria Council is actually a partnership between different stakeholders and the National Malaria Control Program and the communities. Now, one of the most beautiful contributions the in-kind contributions. So the contributions don't have to be financial. They can be financial in nature, but they can also be in-kind. And in fact, in-kind contributions in a country like Zambia, for example, have been the most important contributions that has made a vast difference to the effectiveness of the program and to the impact on the fight against malaria. So I think it is absolutely important for us to appreciate that every single thing that we have is a resource. It is not just about the money.
Thank you so much, Joy. The second question we received is for Mr. Gabriel Jr., who's the director of Mozambique Fundo da Malaria. So we have heard how the EMC in Mozambique has successfully raised $2.6 million in financial and in-kind support to the National Malaria Program. Gabriel, why does the private sector engage in End Malaria Councils?
Hi, Clelia. Hello?
Hello, we can hear you.
Yes, I have some difficult to understand the question. Let me put, yes?
I can repeat the question. So the question submitted was about how we know that Mozambique has raised $2.6 million in financial and in-kind support to the National Malaria Program. So the question was, why does the private sector engage in End Malaria Councils?
Yes, the key of all our work was to advocate to the people, to tell them that this is the time to start with us, to start in Mozambique, to show that we can fight against malaria. And all people can be involved for this fight. You see, was the first time we had this kind of fundraising. People every time was making the donation for things like die for HIV, but when we sensitize them that this is time. This time must start with you. Me, you, all executives, all us have something to contribute against malaria. And when the special things happen, we used a lot the communication strategy, because when one company hear about another company that they was contributing, they come to join with us. This is big strategy. Advocate them, convince them, involve them, and make executives touching another executive.
Thank you, Gabrielle. We have another question for Joy from Philip Welkoff. So Joy, we've heard that we've had a first wave of very successful EMCs. What are the mechanisms for new EMCs to learn from the first group of End Malaria Councils? Over to you, Joy.
What we have done in partnership with ALMA member countries is to create a knowledge hub. We refer to it as the scorecard hub, but actually the scorecard hub contains a lot of the knowledge that we are accumulating on End Malaria Councils, on End Malaria Funds, so that countries can share best practices with one another. And we're in the process of documenting these best practices. so that as countries establish End Malaria Councils and Funds, they can learn what other countries are doing and see whether it is appropriate to introduce it in their own country and also adapt it where it is applicable. So we invite everybody to visit our Scorecard Hub, because the Scorecard Hub will be able to share a lot of these best practices that we are learning from countries.
Thank you. The next question we received was for Dr. Paulin. So how important are these advocacy and resource mobilization efforts for the Gates Foundation compared to the work you do in developing new vaccines, drugs, and insecticides?
Thank you very much, Celia. I think the advocacy work is super important for the foundation. And when you look at the Bill and Melinda Gates Foundation malaria portfolio, led by our colleague Philip and an amazing team of colleagues working across R&D, engaging with global leaders such as the Global Fund and PMI and many other malaria programs to make sure that we think about innovative solutions, places where we as the Gates Foundation can provide the biggest and fastest way of solving and accelerating malaria education, such as research and development and finding new tools. The ultimate goal is that when those tools are available, even either they're new tools or even maximizing the use of existing tools, that the malaria national program at the country level are able to scale up those programs with speed. Now, what advocacy is doing now, and what the work that Alma and our partners are doing, and the End Malaria Council are doing, is actually to bring other people to partner with the malaria national program, right? When you have the private sector, when you have the religious leaders, the traditional leaders, and other people understand that malaria eradication starts with them, and really opening up the national malaria program to those partners who are experiencing malaria on a daily by daily basis. You heard from the private sector how they're seeing the impact of malaria in their operations every day. When you open up with the EMCs and you create that transparency, then you expand the number of people who are actually helping the national malaria program to do this job, right? And also when you start getting the national funds from the private sector to come to complement the government funds, which will actually accelerate the global money that you're getting to move the work forward. So advocacy is core and central to the overall Gates Foundation malaria strategy. So I would say we're part of this, and we're very proud of the work that Alma and partners have been able to do so far.
Thank you so much, Dr. Paulin. One question from the audience here, Gabriel Jr., if you would like to answer it. There's a question about how volunteers be of active use to the End Malaria Council and Funds. Gabriel, over to you.
Yes, please let me, you can make another, again, because I want you that translates, the translates.
So I'll repeat the questions. How can volunteers be of active use to End Malaria Council and Funds?
Yes, what we are doing, we are involving every people to this project. We are inviting every people. Now, what we are doing, we are going following what Elizabeth in Zambia is doing. It's a very good job. In Mozambique, we are going now to connect the parliamentarian forum, and we will connect the sport minister. We will connect the community leaders
because we need to make a big network involving every people, defending this flag that every people can contribute to fight malaria. Now, everyone can make part of this project. It's what we are communicating now. For who must come. We are inviting every sectors, every people to make part, to be volunteers, because every people has something to contribute in this malaria end fight.
Thank you so much, Gabriel. What a great message to end. I'll now invite our Executive Secretary, Joy Pumafi, to give her closing remarks. Thank you so much.
Thank you to the distinguished panel. I want to thank you all for attending today's webinar and for the support of our co-sponsors, the Bill and Melinda Gates Foundation. I want to thank each of the End Malaria Councils and Funds that participated in today's webinar for sharing their experiences and best practices. You continue to be examples of how we can innovate and drive multi-sectoral advocacy, action, resources, and accountability within the African continent. Finally, I want to call on all others to help us achieve our goal as a continent of establishing 15 End Malaria Councils and Funds. Today, we have launched the first toolkit materials on ALMA's Scorecard Hub. On this website, we have published how-to guides and materials on the process for designing and launching End Malaria Councils and Funds. We have also shared module documents. And to access these, please go to scorecardhub.org. Friends, colleagues, partners, zero malaria starts with me. Zero malaria starts with you, and zero malaria starts with all of us. I thank you. Zero malaria starts with me. Zero malaria starts with me. Yako ya me.